You're listening to episode 59 of Present Moment. Welcome to Present Moment, Mindfulness, Practice, and Science. I'm Ted Meissner. Present Moment is a podcast with interviews, conversations, and roundtable discussions. We speak with mindfulness teachers about their newest findings published in peer-reviewed science journals, teachers about their understanding and methods as they work with students of mindfulness, authors about their books and interests, and we also speak with everyday practitioners. The website presentmomentmindfulness.com has show notes for each episode along with resource materials. Dr. Fadel Zeidan joins us to speak about his research findings about mindfulness, pain, and placebo. In this second part of a two-part series, we continue our discussion of recent findings around placebo effects. Far from being false positives, there is research to suggest that not only are these effects measurably in your head, but they employ different neural mechanisms from mindfulness-based practices for pain. Fadel Zeidan is Assistant Professor of Neurobiology and Anatomy and Associate Director of Neuroscience at the Wake Forest School for Integrative Medicine. His programmatic line of research is focused on determining the neural mechanisms that mediate the relationship between self-regulatory practices and health. He is especially interested in determining if and how mindfulness-based mental training regimens affect pain and self-referential processing. He is currently conducting studies to examine the effects of mindfulness meditation on a spectrum of chronic pain outcomes. Fadel was awarded the 2014 Mitchell-Max Award for Research Excellence by the National Institute of Health for his work on mindfulness, meditation, and pain. Our guest today is Dr. Fadel Zeidan. Fadel, glad to be speaking with you again.
Ted, it's always a pleasure. Glad to be here.
So glad to be speaking with you. And what we're going to be talking about today in this second part of a two-part series is going to touch on some areas that you and I share a passion about. The good controls for studies of mindfulness, placebo effects, what they really are, things like that. But let's get started with your new study. It was published in November of this year, 2015. Is that correct?
Correct.
All right. Tell us about the study. What did you do? You've been poking people with hot needles again, haven't you?
Something like that. Thanks for asking. So yeah, this paper just got published in the Journal of Neuroscience, and we're pretty excited about the findings. So we basically have now seen for the last 15, 20 years an exponential growth in mindfulness-based research. We're seeing that mindfulness meditation can improve anxiety, depression, pain, a wide spectrum of health outcomes. And the press, the media has kind of brought mindfulness into the mainstream, where we have covers on Time Magazine, Scientific American, 60 Minutes just did a piece on it. So we wanted to ask the question, is mindfulness-based pain relief more effective than a bona fide placebo conditioning intervention and a sham mindfulness meditation intervention? More important, we were interested in understanding if the brain regions that are associated with meditation-induced analgesia are distinct from placebo. So we conducted a pretty large neuroimaging study where we recruited pain-free, healthy participants that had zero meditative experience. And we scanned all of them with functional magnetic resonance imaging. We used a technique called arterial spin labeling, which is a perfusion-based MRI, and we administered high levels of noxious heat to the back of the leg while they were being scanned. So we toasted them a little bit, yeah. And then we collected pain ratings after that. So we scanned everybody before the interventions. Then we randomly assigned people to one of four groups. A mindfulness meditation intervention. This is a continuation of my previous work where we're looking at the effects of brief meditation training. Only 4 days, 20 minutes a day, and we can get into why we use that later. That's the first group. The second group is a placebo conditioning intervention where we led people to believe that petroleum jelly actually contained pain-relieving properties. And we did this by covertly reducing the temperature of the thermal probe after we removed this cream. And so that process leads the participant to think that this cream actually made their pain go away, in simplistic terms. The third group is a sham mindfulness meditation intervention. And this is where we told people that they were randomly assigned to a mindfulness meditation intervention. And across 4 days, they were taught to take a deep breath as we sit here in mindfulness meditation. So the idea was to match all aspects of the genuine mindfulness meditation intervention, except the explicit instructions related to mindfulness, i.e., focusing on the changing sensations of the breath and body, acknowledging discursive sensory events as they arise without judgment or appraisal, and then returning the attention back to the breath. So it's kind of a hybrid between breath awareness and insight meditation. And the fourth and final group was the book listening control group. And this group listened to the natural history of cell burn across 4 days, which is not the most exciting book.
Yeah, somewhat excruciating, I think. I think I'd rather be burned by the hot needles.
Many have postulated that listening to the book itself was a pain manipulation. So after everyone completed their respective interventions, they came back into the scanner. We stimulated their leg with noxious heat in response to their respective manipulation. That is, mindfulness meditation, placebo cream, sham mindfulness meditation, and just mere rest. Just close your eyes and don't move. And that's what the control group did. And so we found something, we were really surprised. Quite frankly, we thought that mindfulness meditation would resemble placebo, especially sham mindfulness meditation. But what we found was that mindfulness meditation was significantly more effective at reducing pain when compared to all the groups. Importantly, all the placebo conditions, placebo cream and the sham mindfulness meditation intervention, were very effective at reducing pain when compared to the control group. So sham mindfulness meditation was very analgesic. Now, you may ask, I have to back up a little bit. You may ask, how do you know that the sham meditation group thought that they were meditating? Well, we asked the mindfulness and the sham mindfulness meditation intervention groups, how effectively did you meditate? And we asked them this with a visual analog scale rating. It's a rating scale. We asked them this every session of their intervention. The sham mindfulness meditation group actually rated higher than the genuine group in perceived efficacy. And can you imagine why?
Yeah, my guess on that would be there is first a bit more relaxation around it and a lack of insight about how much their mind was wandering because they weren't attending to that as directly.
Sure. And as you well know, practicing mindfulness isn't very easy. It can be very frustrating. So here, if you're just taking deep breaths and you think that you're practicing meditation as described in the sham group, they probably thought that they were, experts. Yeah, like you said, there's relaxation. I feel great. I'm really good at this. Versus the genuine group, I really had trouble focusing on my breath. I don't know if I'm doing this right, So we actually, and it wasn't significant, but both groups felt that they were equally as effective at practicing meditation. However, only the genuine mindfulness meditation group significantly increased in mindfulness levels, as measured by the Freiburg Mindfulness Inventory. So we demonstrate that the sham meditation group believed that they were meditating, but only the genuine group reported significant increases in mindfulness. So that was a precursor to moving on to the findings.
Yeah, tell me more about that. I know you had some expected findings and some surprising ones as well.
We were surprised that mindfulness meditation produced a distinct pattern of neural activation than sham mindfulness meditation and placebo conditioning. So what we found was that mindfulness meditation reduced pain by activating the orbital frontal cortex, the perigenual anterior cingulate cortex, and the right anterior insula. That is, greater activation in these brain areas were associated with greater reductions in pain, which are remarkably consistent with our first paper in 2011 that was also published in Journal of Neuroscience. So we were able to more or less replicate our previous findings, which is, as a neuroscientist, quite a feat.
Very helpful, very reassuring, I'm sure.
It's hard to, yeah. So that was great. So these are brain regions that are associated with cognitive reappraisal of pain, i.e. the cognitive control of pain, as well as emotion regulations using unique emotion regulation strategies. These are also brain regions that are implicated in altering the context of our sensory environment. So very consistent with the principles of mindfulness. The placebo conditioning group just reported they produced significant reductions in pain, and those pain reductions were associated with reductions in pain-related brain activity, specifically in some of the somatosensory, the sensory processing areas of the brain, which is consistent with the literature. So that was great. And the sham mindfulness meditation group, this was what was really surprising. There were no brain regions that were significantly correlated with pain reductions during sham mindfulness meditation. But what was predictive of analgesia in this group was reductions in respiration rate, which is very consistent with the so-called relaxation response. So we have some clear, distinct mechanisms involved in all these cognitive manipulations.
Was there a measurement or a difference that you noticed in vagal tone? Was that even something being measured?
It was not. The heart rate recordings that we had did not have a high enough resolution for us to conduct heart rate variability. However, we are conducting that study right now. In fact, my student was just awarded a Varela Award from the Mind and Life Institute to ask this question. So we're on it, Ted.
Good. Great minds, Fadel. That's my story, and I'm sticking with it.
Indeed. So that's, basically it in a nutshell. It's a very large nutshell because I was a bit verbose, but we found that mindfulness meditation was more effective at reducing pain than some very robust placebo conditions, and mindfulness meditation engaged a distinct neural pattern of activation than the rest of the conditions. Now, we've also now have repeatedly seen that mindfulness meditation reduces pain through really unique mechanisms that we haven't seen in other types of cognitive manipulations. For instance, we see that mindfulness meditation deactivates the thalamus when compared to rest. And the thalamus is a very old brain region, evolutionarily speaking. Nothing from the body can enter the brain without going through the thalamus. It is the sensory hub. It's the gateway, if you will, of sensory information. And what we see now repeatedly is that meditation deactivates this brain region. And we're also seeing that higher order brain regions, executive control brain regions, are directly related to producing analgesia as a function of mindfulness. So what we postulate is that higher order brain regions such as the orbital frontal cortex and the anterior cingulate cortex are down-regulating the thalamus to inhibit nociceptive information from being elaborated throughout the brain. And we're also finding again that there's multiple mechanisms here. So cognitive control, emotion regulation, and attenuating low-level processing in the brain.
Very nice. So let's talk a little bit about just placebo itself, and that being a dirty word in some contexts, maybe not so. I'm wondering if you could talk a little bit about that.
I think placebo is great. I don't think of it at all as a bad word. It is a psychological phenomenon that is directly related to promoting health. The point that's important here is the fact that cognitive behavioral therapies, pharmaceuticals, all types of drugs that we use to benefit our health have to go through multiple phases of placebo-controlled trials before they can be administered via the FDA into the general public, and before we can actually demonstrate the efficacy of said intervention/drug. But we really haven't done that with mindfulness meditation, which arguably can be the most susceptible to placebo/non-specific related effects. So I think what we were so excited about is, in a very basic scientific approach, at a first phase, a very first step, that there is evidence that mindfulness meditation reduces pain above and beyond the effects of very strong placebo conditions. Sham mindfulness meditation reduced pain by 24%, and the placebo cream reduced pain by 13%. Mindfulness reduced pain by 44%. So all of these techniques were very analgesic, if you will. But there's something else that is going on with mindfulness that is unique to these other non-specific effects.
Yeah, and it's clear that with differences in brain regions that are being activated, that it is, by its very nature, something different is going on here.
Yeah, we need to do a lot more research in this question, maybe more robust control conditions, different outcomes, anxiety, depression. And then, again, this is critical. We conducted the study in healthy, pain-free people, and we used experimentally induced pain. So it could be a completely different ballgame in chronic pain patients. And we're developing studies right now to address that question.
So what might some of the additional implications of this be?
I would hope that someone with chronic pain would feel less skeptical about at least trying this technique, even as an adjunct with their existing pain therapies, in light of these findings. I really don't know how to answer that question. I think that's up to the clinician and the patient and people like you. I would hope that someone that is suffering from chronic pain would look at these findings and say, okay, maybe this is something that I can try to see if it alleviates my suffering. But again, this is a first step. We need to do a lot more work before we can really say mindfulness meditation is going to significantly reduce your pain and alleviate suffering. So this has to be a calculated and carefully controlled step-by-step process.
Yeah, it's interesting to hear every time I do an interview with a researcher that there's great concern around doing things carefully, doing things correctly, doing things in as controlled a fashion as we can in this early exploration of what's going on, particularly when we have tools like fMRI, things like that, to help us see what's going on. Quite in contrast to what the hype against mindfulness practices might be. And I'm wondering if we might take a moment and step to the side about some of what the media has done with this particular study. I noticed a comment from you online about one headline about this mindfulness being more effective than morphine.
Yeah.
And your statement was, we don't mention morphine anywhere in this study. Can you say a little bit more about that and what you've seen the media do?
Well, it's all about hits and ratings. So they need to say whatever they have to say to get as many readers or viewers as possible. So one attention-grabbing headline would be that meditation is more effective than morphine. Some of this is our fault in the first study that we published in 2011, where we actually did not compare mindfulness to morphine, but we cited a study that used the same heat paradigm and the same pain scales that we used, and they found that a clinical dose of morphine reduced pain by 21%. So we said in that paper, these effects are pretty dramatic. considering that one clinical dose of morphine reduces pain by 21%. In that study, we found that mindfulness reduced pain unpleasantness by 57%. So we don't mention that in this study. We didn't bring up morphine. So it's inaccurate because of the damage that it could produce for someone that wants to try this out to treat their pain or depression, because it leads to false expectations and false hope, if you will. So if your expectation is for a dramatic amount of pain relief, then mindfulness may not even come close to that level of expectation, and therefore the practitioner / patient may not continue to practice or try meditation. So I think it's critical for the media to temper their interpretations of meditation findings just for the sake of the patient, for the sake of the consumer that's thinking about trying this out. It wasn't the most elegant response, but
I think you captured it well, is that there tends to be a habit on the part of the media today to latch on to something which has a grain of truth, but may be grossly misleading about what's going on. And I don't see that in the researchers themselves. And what happens on the part of the McMindfulness, the McCritics, started calling them, is that they'll push back on the researchers and the research itself rather than journalistic exaggeration of what's going on. And that itself is very harmful to the progress in learning more about what may be going on.
Right. And I know a lot of mindfulness researchers are the same way, where we really are guarded and try to temper our research findings just to speak directly to what the data are telling us. And we were very cognizant of this when we wrote this paper up. I'm just concerned that this mindfulness movement, if you will, the bubble will pop if, we continue to, how about this, if the research isn't conducted with the highest standards and rigor, and we don't speak beyond the data. Those two in combination, I feel, will really help us understand what mindfulness is, how it works, and for who it will work for. Because we still don't know this. The mechanisms involved still are poorly characterized. I mean, we're getting better at it, but we don't know if, mindfulness will work for fibromyalgia versus complex regional pain syndrome. Different, what if mindfulness is effective for one form of chronic pain but not another? So it's good to temper the findings, especially in the context of our study, because it was in healthy people. It was only 4 days of training, which is, something that is really important for us to do is the brief training. We talk to clinicians all the time. They actually inform our designs, and they're the ones that tell us if the intervention is a couple of months long, let's say 4 months long or whatever, and then the patient is going to be less inclined to try the technique because they can just very easily take an opiate, and they'll get relief. It's not a cure, not improving their quality of life, but it will dampen the experience of pain. So they would much rather take a pill. But if we could show them that the benefits of mindfulness can be directly perceived, if the pain relieving effects can be experienced after just a couple of days of training, then the patient will feel more inclined to continue to practice, and the clinician would find that this technique is more attractive to recommend to their patients. So that's why we employ the 4-day intervention, just to make it as feasible as possible for a patient.
Well, and I think you also touch upon something that is worth considering for someone who is seeking something to help with their pain, whatever it may be, is that this is just a 4-day intervention, short amounts of meditation. There may be different, greater, lesser, we don't know, effects based on longer term practice. And I wonder what that means, just as you compare it with a pharmacological intervention in terms of costs and patient care. How much are you spending on medications every month? What would it be like to your bank account if you had something you could do on your own that didn't cost you anything, but maybe 20 minutes a day. How would that look? What might that change for you? And not to suggest, again, this is part of the caution, Fadel, that I completely agree with you on. Occasionally at the end of a retreat, people will stand up and say, I'm going to stop taking my meds because I feel so much better. And they've just not really cognizant of having been in the rarefied circumstance of a retreat setting, which is not like their day-to-day life.
Absolutely. A retreat setting is gorgeous. Just walking into that setting can be analgesic, can be health promoting.
Exactly. And I think people may sometimes, in their exuberance of that experience that you're talking about, be maybe skiing a little bit past the tips of their skis by taking action that might not be warranted yet, and maybe a little more prudent caution, trying things out a little bit at a time with the participation of their therapists, their doctors, the people that they've already been working with, and not just on their own. I think that's one of the most critical things that is important for those of us in mindfulness to share, is that people do need to be cautious and not take rash, imprudent action, particularly with their health.
It's well said. Absolutely. I agree with that 100%.
Fadel, is there anything else you'd like to share with the listeners?
We have some new findings that are hopefully be coming out soon that are going to provide some more insight into how mindfulness reduces pain and potentially promotes health. So definitely stay tuned, and we are working on this question of understanding not only if mindfulness meditation improves health, but how, and understanding what is the difference between dosage 4 days versus 4 weeks versus 8 weeks and so on. We're still at it. So I definitely appreciate your interest in this line of work.
Eager to hear more. Our guest today, Fadel Zeidan. Thank you for being here. Folks who are listening, I will be posting a link to the full PDF of this study, so be sure to check out the episode page for this episode. Fadel, thanks for being here.
Thank you so much.
Thanks for listening. If you'd like to learn more about something you've heard in today's podcast, please come visit the website at presentmomentmindfulness.com. You'll find an entire webpage devoted to this and every episode. You can comment on the episode page and find show notes and other helpful resources for your mindfulness practice. The shakuhachi music heard on Present Moment is used by permission and through the generosity of musician Rodrigo Rodriguez. His website is linked on the Present Moment website on the About Podcast Music page. Sound editing, mixing, and mastering provided by the generosity of Anthony Dominello of StructureFromSound.com. Until next time, remember, every moment you have a choice. Make it the best you can. See you next time on Present Moment.